Happy Monday! Here we are with Dr. Bita Badakhshan. Dr. Bita is a medical doctor. She has an extensive experience. She's been to school in California, New York. She did a lot with acute care and emergency room experience. That led her to internal medicine. She is brilliant and has been working under Dr. Keneally for the past years, and is amazing at understanding the root cause or the origin of the illness and uncovering that. She does both integrative, preventative methods, and she also is into cancer prevention, and she also does treat our cancer patients. So with that, we're going to talk about inflammation today. Please share this with your family and friends, because education will empower you. Thank you.
Thank you, Kitty. Thank you guys for coming. Thank you for listening, tuning in. So how many of you guys wake up in the morning with stiffness of joint, feeling fatigue, exhausted? So this could be a sign of chronic inflammation. So I'm going to talk about chronic inflammation. Every day, daily basis, we could have an acute inflammation. You may have a cold, viral infection, which can cause acute inflammation in your body. You may develop fever or chills, which is good. It's your body's response to the virus or to the bacteria. So you don't want to take ibuprofen or Tylenol to suppress that fever. That fever is a good response. Or you may hit your joint and your knee may swell up, it may get red, it may get inflamed, and that's another sign of acute inflammation, which is good to have. But chronic inflammation is not good. Chronic inflammation can lead to chronic diseases, it can lead to heart disease, it can lead to cancer. So how do we know? If you don't have these basic symptoms, you may not have fever or chills, you may not have stiffness of joint. How do you know you have chronic inflammation? So it's very simple. It's a simple blood test that you could do, which is called high sensitive C-reactive protein, which is called HSCRP. So if it's greater than 1, that means your body has inflammation. Usually you could differentiate between chronic and acute by looking at your HSCRP. If there is a big spike of HSCRP in an acute setting with a viral infection, or it's okay here, my boy is joining us today, but with the acute setting, it will be really high. The HSCRP will be 15, 12, it could be even 6 or 8. But with chronic inflammation, the HSCRP goes up slowly. It may start as 1.5, then next year 2, next year 2.5. But one of the problems we have now is a lot of labs, their optimal level, their level that they say is normal for you, they may say less than 3 is normal. But really its cutoff is 1. So any HSCRP greater than 1, that's not good. That means you have this chronic inflammation in you. So why do we have it? What causes it? So stress, chronic stress can cause it. So what you want to do is make sure you exercise. Lack of exercise is one of the reasons. So you want to exercise, do yoga, do meditate, whatever that can help you to bring your stress level down. That's important. Number 2 could be food, processed food, food high in sugar. That can cause inflammation. And maybe foods like you're allergic to, hidden allergies that you're not aware of. So what you want to do is maybe do food allergy testing. Let's say if you eat a broccoli and you get bloated, doesn't mean broccoli would be good for you just because broccoli is good, but it doesn't mean it's good for everyone. So you want to do food sensitivity testing to find out what food allergy you have, to rule out the food allergies so you don't trigger your body's immune system constantly. Another thing could be like rheumatic arthritis. why do people have this chronic inflammation? That could be because of Mycoplasma pneumonia has been really linked, bacterial infection has been really linked with rheumatic arthritis. So you want to get rid of that bacteria. Or if you have viruses in your body, that can cause chronic inflammation. So chronic viruses, so you want to get rid of the viral infection. There is different way. As a conventional doctor, I can't tell you there's a medication that you could take for chronic viral infection. But there is a tea, like Isiac tea, herbal tea that you could take that suppresses, boosts your immune system to go after viruses. And then we discuss chronic bacteria, chronic viral, food allergies. These are the sign of chronic, this can cause chronic inflammation. So what supplements can we take? What can we do about it? So let's say you remove the root cause, you remove the food allergy, but you still have that low-grade inflammation. So that means something else is going on in you that you haven't figured that out. Sometimes what I do on patients, I put them on omega-3s. Chia seeds have high omega-3. Wild salmon has high omega-3. But you want to make sure it's a small, not King's wild salmon, that has high mercury. So then you could also do enzymes, natural enzymes like wobenzyme. You could take first thing in the morning on an empty stomach, or you could take at night on an empty stomach. That can bring the inflammation down in the body too. Sometimes simple as having apple cider vinegar first thing in the morning. You could have that with a teaspoon of honey. That sometimes help with inflammation. And then papaya, for example, papaya has high enzymes that you could take that can help you with inflammation. And turmeric, curcumin is another supplement. A lot of people who are in sport, who have joint pain, knee pain, they develop knee pain after playing volleyball or golf, back pain. If you take high doses of curcumin, turmeric, that which means like curcumin 1,000 milligrams 3 times a day, that can help with inflammation. And using turmeric as a spice in your food can be helpful. In terms of supplement, vitamin D3 plays a key role. Sometimes just by fixing patients' vitamin D3, the inflammation will go down. And I really don't recommend Motrin or ibuprofen for inflammation, because that's okay temporarily. Let's say if I have an acute injury, yes, I was an urgent care doctor, I would say do take Motrin, ibuprofen, 800 or 600 milligrams 3 times a day, only 2-3 days. Then your inflammation will go down. But you don't want to be on those chronically, because then you could get gastric ulcer. So anyways, I think that's all about inflammation. So does anyone have question out there? Do you have any question, Jennifer? Or do you guys have any questions?
Inflammation with RA and the approach that you would take for
Yeah.
remedies for RA?
Yeah, so for rheumatic arthritis, again, that's what you have. So I would do the Mycoplasma pneumonia, the blood level. That tend to be high in patients with rheumatic arthritis. Sometimes stress can trigger it. Sometimes stress. Okay, you know what? My boy is joining us tonight, so he's going to be sitting here, be with us. He misses mommy when she works during the day. So anyways, so you want to know the bacterial, what is it? I do food allergy testing. I get patient off gluten, so no gluten or nightshade vegetable. Dr. Gondry, he's a famous cardiologist who wrote a book that removing the high lectins from your diet, that can bring inflammation, but that may not necessarily trigger rheumatoid arthritis. So you have to look at the root causes. Always, usually it starts with infection in the mouth. I would go see a biological dentist. And exactly. So you wanna treat that bacterial infection. Otherwise, that can trigger it. And if you have stress, that suppresses your immune system, and that can trigger it as well. Yeah, so I've been having multiple rheumatic arthritis patients that I got them off of their medication. I tapered down, and I try to manage them naturally. Sometimes even putting them on high-dose IV vitamin C can help. High doses of vitamin C brings the overall body's inflammation down. It kills the bacteria, kills the virus.
Can chronic inflammation happen if, let's say, you don't see any exterior appearances from inflammation?
Yeah.
But it could be still.
Exactly, that's what I said. So there is a simple blood test, the high sensitive, you want to make sure it's high sensitive C-reactive protein, HSCRP, because there is a CRP as well that's not as sensitive. So when you do that level, and if it's more than 1, anything greater than 1, that means you have some sort of inflammation going on. You may not have any symptoms, but it causes damage to your body. Yes. Any questions on Facebook? People are.
One person. Hello, I'm Carrie.
Hi.
But the reason I asked is because last summer I had like the worst hives on my skin and stuff like that because of that. It didn't pinpoint whether it's food or topical and stuff like that.
So the hives on the body, it could be food allergy. So first thing you want to do is you want to make sure you do a food allergy testing and have someone. Here at the office, we have Mitzi who does our food allergy testing. Or another thing, I had a patient coming in with hives, and that was due to high iron, ferritin level. And by the way, elevated ferritin could be a marker of acute inflammation too, with the HSCRP being high. Ferritin is stored iron, and sometimes if it's on 300s, 400s, that's another sign of acute inflammation going on in the body. So do we have any question out there for our watch?
How do you, if you have a hurt, you hurt, certain things hurt, or what is inflammation? Did you go into, like, what, if I have a pain in my hip when I sleep, or what do I need to take?
So yes, we did discuss that. So what supplements you take, you could take high-dose turmeric, but first of all, you want to look at the root cause. So some people can have hip pain, knee pain, this. So that could be due to food allergy. Once you remove the food allergy, the joint pain goes away, the muscle stiffness goes away. So that could be it. And in terms of supplement, we discussed omegas, enzymes, and curcumin or turmeric.
Okay. Does vitamin C?
Vitamin C can help too. As I said, high-dose IV vitamin C helps with inflammation.
Okay. And can you tell with inflammation when you get blood work?
Yes, we discussed that. Yes.
Repeat the question.
Okay, yeah. So for blood work, how do you know if you have high inflammation? The HSCRP, high sensitive C-reactive protein, would be a great marker for inflammation. You want to make sure it's less than 1. Lash.
Michelle asked, great question, was not aware king salmon is high in mercury. Would any other salmon be good?
Can you say it loud enough and you have to repeat?
What was the question?
They said great information, was not aware king salmon is high in mercury.
Oh.
King salmon.
Yeah.
Salmon is high in mercury. Would any other salmon be good?
So, yeah, so the thing is, king salmon is like a small tuna, and tunas has high mercury, and so does king salmon. So smaller salmon you want to consume. Smaller salmon. Shh, I'm almost done.
Websites too that have, like, you can look up mercury levels.
Yeah, there are websites you could go on and look at the mercury level.
Okay.
Okay, thank you all for tuning in today.
Okay.